Understanding Helicobacter pylori, H. pylori, infection, causes, symptoms, and prevention. Helicobacter pylori, H. pylori, infection is one of the most common bacterial infections worldwide, affecting over half of the global population. H. pylori is primarily acquired during childhood and remains a leading cause of stomach ulcers, peptic ulcers. While many carriers don't exhibit symptoms, the infection can lead to significant health complications. With proper education and awareness, people can mitigate risks and seek timely care to prevent severe outcomes. H. pylori is a bacterium that infects the stomach lining, often persisting undetected for years. It is a major contributor to gastritis, peptic ulcers, and, in some cases, stomach cancer. However, not everyone infected by H. pylori experiences illness. The reasons behind this vary, including genetic predispositions and external environmental factors. Most people with H. pylori infection are asymptomatic, meaning they don't experience noticeable effects. However, for those who do develop symptoms related to a peptic ulcer or gastritis, they may include persistent or burning abdominal pain, typically worse on an empty stomach, nausea and loss of appetite, bloating and excessive burping, unintentional weight loss. If you experience these symptoms, it's essential to discuss them with your healthcare provider. H. pylori infection is highly associated with certain living conditions, particularly in childhood. Key factors include crowded housing conditions, lack of access to clean, running water, residing in developing countries where sanitation challenges are common, living with a household member who has an H. pylori infection. Improved hygiene and sanitation significantly reduce the risk of infection. If left untreated, H. pylori infection can lead to peptic ulcers, caused by acid breaking through the stomach lining, chronic gastritis resulting from prolonged stomach inflammation, an increased risk of stomach cancer. Preventing H. pylori begins with maintaining good hygiene practices, such as regular hand washing and consuming only clean, safe food and water. If you're concerned about the risk of infection or have a family history of stomach cancer, consult your healthcare provider about testing and possible treatment. Early treatment with antibiotics can help manage complications and protect long-term health outcomes. Health education and early detection are vital in combating the effects of H. pylori and promoting overall well-being.